There's some very interesting data and some really interesting data points connected to our topic today. Nearly 3/4 of leaders believe their own organizations will remain stable or improve. 52%, though, expect the broader healthcare industry to decline in 2026, which is certainly the majority here at 52%. Based on what you're seeing across health systems today, why does 2026 present a true inflection point for healthcare leadership? And it's not just something that we've seen before in terms of disruptions, which certainly we've seen. Rob, I'd love to start off with you on this one.
Yeah, thanks, Lucas. I think there are several factors that are kind of converging and colliding, if you will, to create this very unique situation and circumstance for healthcare in 2026. You think about the federal mandates now and what that's doing from a financial standpoint, reductions in Medicaid, other reductions that are putting some downward pressure on our financials. Rising cost of labor and expenses, that continues to be a challenge for us. Supply and demand, simply not enough clinicians and physicians out there to meet the rising demand, and that's going to continue moving forward. We have what I would say this rapid expansion of AI, and that is presenting significant opportunities. It's exciting, right? We have great opportunities there to leverage AI in ways that can bring exponentially greater levels of quality, but that's impacting healthcare systems and hospitals across the entire continuum. So how do we lean into that? How do we embrace that? How do we bring leaders in or upskill our leaders to be able to embrace that and leverage AI in an appropriate way in a healthcare setting? And then finally, I'll say, we continue to see the expansion of the ambulatory care, post-acute care, chassis, and a little bit more of a recession, if you will, or slowing down of the acute care on-site traditional hospital setting, although that's going to continue to play a major part moving forward. We know that as well. And the last thing I'll say, and then I'll turn it over, is payers, right? Payers. And I think that that's an opportunity that we're going to have to continue to work through. What does that look like for reimbursement and payment of services that our providers are delivering every single day? And how do we continue to work through that so we can reach a happy medium that creates financial sustainability for healthcare systems and hospitals moving forward?
You mentioned something very important, which is the complexity in and of itself. We've seen challenges before, but I feel like these challenges are becoming more complex, at least from my observation point. And Betty, we talked previous to our webinar here today. You do a lot of traveling. You meet a lot of leaders. You meet a lot of health system leaders across the country. Again, from your perspective, why does 2026 represent a true inflection point for healthcare leadership?
Yeah, what I'm seeing from my side is leadership turnover, I think, will accelerate. Burnout, financial pressure, increasing board expectations. Those things are pushing more C-suite executives to consider transitions. So now more than ever, we're having more and more career discussions with key senior executives. In addition, I think boards are becoming less tolerant for slow growth and stagnation. They're expecting leaders who can not only stabilize operations, but also drive strategic growth. And lastly, generational leadership shifts, I think, are also, we're starting to see more and more seasoned leaders nearing retirement, and the new emerging leaders often bring different expectations around work models, technology adoption, career progression.
Richard, I saw you nodding your head there specifically on the stagnation aspect of this, and certainly the generational shift as well. Would love to get your perspective on what you're seeing here too for 2026 and why this is different.
Yeah, I think it's a very valid point. I think, as a lot of us know, in the physician workforce area, recruiting is hard. There's a physician shortage. We've talked about it for 20 years. I think it's finally here. But what makes it even more difficult is what a lot of folks are finding is to find someone to replace somebody who's in their 60s, who's retiring, who was brought up in a different work environment, it takes 1.5 to 2 people to replace those folks, simply because of taking call and the amount of work that the current generation wants to do. And they probably have a better work-life balance than people a generation ahead of them. But it's creating shortages, and it's financially demanding. The other thing that I find fascinating, when you talk about cognitive dissonance, right, to your opening remark, is that 3/4 of folks think their organization's going to do fine, but 52% think the rest of healthcare is not going to do well. You can't have both of those. So that cognitive dissonance, I'm going to be fine, everybody else is going to take a hit, is not going to play out. It's not going to happen that way, I think. And to Betty's point, there's a lot of pressure from boards right now, I think, on leadership to perform.
Mike, just really quickly too, I saw you laughing there on the dissonance piece. Is that, would you agree with that? Is that similar to what you're experiencing too?
Yeah, I think it is. And I think, you know, it kind of depends what market you're in and what we're talking about with the health systems, because we're in, I didn't mention before, but we're smack dab in the middle of Oklahoma. And it's a state that's, you know, doesn't usually rank high in healthcare across the United States. It usually ranks bottom 5. And we're faced with a really challenging and real issue with our rural hospital network in terms of their ability to sustain and survive. And to the points that Dr. Freeman mentioned, being able to recruit physicians to the rural communities is becoming increasingly challenging. And so as a result, many of these systems really struggle to even just stay afloat. And how do you effectively partner with those to provide care for those patients that need it really desperately and still support them along the way? So that's why I was nodding my head with respect to that, because we're seeing it play out in rural parts of the state.